Hi, welcome. We're going to be talking about the sting and apiary safety. My name is Laurene Kiel. My background as a beekeeper has been about 12 years, a little over. My professional background is as a registered nurse with a BSN. I also have a master's degree in nursing in clinical nurse specialist and nurse manager. And I went on and got an additional master's degree as a nurse anesthetist, which I've been doing for the last 21 plus years. Prior to that, I worked in an intensive care unit. Why did I choose this as a topic? Primarily because as beekeepers, we're not taught a whole lot about safety. It's kind of the background thing, but we've never really, in my experience, and I'm a continuing education kind of girl, we don't talk a lot about the safety thing, especially with relation to what stings are and what they can mean. And for this reason, I've decided to address this topic. We can talk about the basic apiary safety, and that includes how you access your apiary with the topographical concerns, how you get to it, how you're able to work your bees. You might talk about some of the biomedical concerns, which primary is lifting, and supers can get very heavy. It's a lot of stooping and lifting, and these are some basic safety concerns. Additional equipment may be needed to make it easier for you to work your hives. And by that, I'm talking carts, gators, potentially something to help lift. It may also mean a helper in your apiary. Additionally, smokers are hot. They are a fire hazard, and many a beekeeper have started potential fires on their carts or in their hive area. There are also the chemical hazards, which are primarily your mite treatments that you need to be cognizant of. But these aren't really the concerns I'm going to address on a huge amount in this presentation. My goal here is to understand the mechanism of the sting, and that includes covering some of the components of venom. I want you to be able to differentiate between a normal versus an abnormal or emergency anaphylaxis reaction. And you need, as a beekeeper, to consider the risks of beekeeping. Consider what you can do to prevent problems from the sting. And I want you to understand some basic reading of the hives to avoid problems with sting. Additionally, you need to know, as a beekeeper, when you need to call 911 when you or a fellow beekeeper needs to get emergency help. We always get asked when we start beekeeping, or you tell somebody what you do for a living or a hobby, that you're a beekeeper. They want to know if you're going to get stung. Yeah, honeybees sting you, and they really don't want to do it because they're sacrificing their life for you. How you approach your hive makes a huge difference in stings. And obviously, we've all told genetics play a big role, which is part of the reason we try and keep down the bee genetics from the killer bees, aka Africanized bees. Obviously, we all know this, and this is just review. A worker bee stinger is barbed. It includes a sliding mechanism where the stinger, which is attached to a venom sac, is ripped from the body when she stings you. The venom sac continues to pump even when it's detached from the worker's body. And with each sting, you have been marked with an alarm sent. That worker dies, and that worker sacrifices for colony defense. The mechanism of the sting is essentially a barbed stinger. This is a really cool magnified view of the stinger with a honeybee who has its guts pulled out when that stinger is in the victim, and that means you. And as that bee stings, the blades alternate and it scissors into your flesh. It kind of acts like a screw anchor, meaning once it's in, the stinger can't be retracted. The muscles that are connected to that stinger to the venom sac pumps that toxin in as long as that stinger and the venom sac is attached to you. Again, a schematic of how that sting buries it into the victim. It works as a scissoring method, and it has a kind of hardened plate behind it, a stylet, that keeps the whole thing fairly rigid when it's injected into you. And again, another schematic. The stinger mechanism consists of that serrated blade that's digging into you, that stabilizing rod behind it, and not only a muscle is ripped out of that worker bee's body, but the venom sac, and it continues to pump into you to deliver that venom into that victim. Obviously, we know that queens and drones have a slightly different stinger. The queen stinger is not detached when she stings you. I was always told it was not barbed, but the information I received and when doing this research is that it is barbed, but it is not as barbed as a worker bee. So she's able to sting multiple times without ripping out her body parts. And obviously that's used in defense and fights with other potential queens. The drone, because it is male, does not possess a stinger. Only the females do, because it's an adapted female organ used to deposit eggs in the bottom of the cells. What's in bee venom? The majority of it is mainly water. Its pH range from, and obviously you can read this, about 5. It also has 63 components, which I am not going to review. Primarily, these 5 components are of interest to us, and I want you to take a look at, these are all listed as dry weight, but take a look at some of the things these components actually do to add that toxicity to the venom. The first one causes red blood cell rupture. It causes the vessels to dilate, which cause not only pain, but potentially can cause a drop in blood pressure. There's some phospholipidase, A2, which causes destroyed cell membranes and pain and inflammation. Of particular interest to me is the histamine, which composes about 9% a dry weight. And histamine causes those capillaries, which are the smallest blood vessels in your body, to leak fluid, causing pain and itch. Remember that 9% of histamine, because it's going to be important as I talk a little bit later. And again, we get items that destroy the nerve tissue and also a component that causes the reaction to spread by diffusing the whole toxic cascade, as it might be known. This was a good article by Riddle, and it was in Bee Culture. The usual response to an insect sting is, of course, we're not real happy to have a sting occur on our watch. And when we first get stung, when we're beginning beekeepers, usually we have this type of reaction. But in a medical sense, responses to the sting are graded according to the magnitude of the reaction as either moderate, mild, or severe. And additionally, those responses to the sting, and by this I mean your body's response to the sting, can be characterized as either a normal reaction or a not normal reaction. If it's normal, it's considered localized to where that sting has happened. If it's systemic, it occurs in an area far removed from where that stinger was placed in your body, and it's not normal. The best research I could find says that about 25% of the population can have large and localized reactions. But a severe reaction, which is called anaphylaxis, or severe reaction to a sting, has about a 25 to 65% of a truly life-threatening reaction called anaphylaxis with that next sting. And though I did not see real numbers for how beekeepers fall in that time frame, my assumption would be, and we know what we say about assumptions, would be that beekeepers have a higher risk to a more severe reaction because of our exposure. What's a normal reaction to the sting? And again, we're talking about a localized reaction to that sting. And it's graded. It may occur and show as redness, heat, swelling, itching, or pain. If it's mild, it usually resolves in a few hours. A moderate reaction may have that redness or swelling enlarge over days with a resolution in 5 to 10 days. While it's still considered a normal reaction to a sting, it may not go away in the first couple days. So it shouldn't be a surprise to anybody that you may have a reaction that lasts a little bit longer than those people who have been beekeeping for a long time and say, 2 days and it was gone, or a couple hours and it's gone. This is the pictures of horror, which essentially are mild to moderate responses to stings. They're localized, they're in that area where the sting actually occurred. That may not mean it's a small area where you're swelling. It may be that whole eye, it may be an entire fat lip. It may be that you have mitten hands, as shown in that lower picture on the left. And sometimes that swelling will increase over 2 to 3 days. Some medical individuals mistake it for an infection, which it is not. It's an inflammation response. Infections are rare with bee stings. What do you do with a minor sting reaction? The immediate thing you do is to remove the stinger, scrape it out. You obviously don't want it giving the entire possible dose that you can get from it staying on board and continuing to pump. The treatment is symptom oriented. All these things I'm discussing now actually are over-the-counter medicines. Obviously, I'm not a physician. I cannot prescribe medication, but I'm telling you what I do, and I'm telling you some of the things that we use in the operating room if I was concerned about you having an allergic reaction. These are some of the same type of drug classes I would use, but what I'm suggesting is potentials that you can buy over the counter to use with a sting. And these are primarily over-the-counter antihistamines. Remember that one of the components in Venom was histamine. Additionally, a normal body response to an irritant that includes an injected venom is an inflammation response. And an inflammation response releases histamines from the destroyed cell. It's a way for the body to say, hey, something happened here. I'm going to swell. I'm going to bathe that area in white blood cells and try and take care of the problem. Antihistamines are classed primarily in two ways. And here I have it listed as histamine 1 and histamine 2 antihistamines. You can actually take both histamine 1 and histamine 2 antihistamines at the same time. What I'm cautioning you to do is make sure you have them in your to-go to the bee yard bag or in your medicine chest or where you can get to them very quickly, but you need to make sure you are medically able to take antihistamines before you ever need them. And by that, you can easily look on the label of what I'm going to say I keep in my medicine chest. So be sure you can take it before you actually ever pop the pill. You can also take an over-counter pain reliever. This would be things like Motrin or Tylenol. That's essentially for the swelling and the pain. The recommendation is to avoid aspirin. Aspirin can increase the risk of bleeding. And again, when we refer back to the Venom components, some of them destroy red blood cells. So you don't want to add another drug that can cause bleeding. You can ice or cold compress the area, and you can use topical ointments, hydrocortisone or calamine cream. If your symptoms change, and by that I mean if they go from a localized reaction, a reaction in the general area where you were stung, to something far removed, that now becomes a medical emergency and you need to call 911. What I'm going to discuss here next is how you differentiate when things go from, okay, I got a bunch of stings, to worse. And sorry, I should say that's in a slide or two. Here's the over-the-counter histamine 1 and histamine 2 blockers, which is what antihistamine is. Histamine 1 blockers are primarily used for seasonal allergy type things, and that includes Benadryl, which can be anywhere from 25 to 50 milligrams that can be taken every 4 to 6 hours. Some people have problems with Benadryl making them sleepy, and oftentimes that's the 50 milligram dose. 25 milligrams may or may not bother you. If it does, don't take Benadryl. Claritin or loratadine, which is a 10 milligram dose, is a 24-hour type for seasonal allergies, for pollen allergies, and they're pretty safe profile. Zyrtec also is a seasonal allergy medicine, and they can both be taken once a day dose. Histamine 2 blockers, H2 antihistamines, are listed there on the right. They are first generation drugs that were primarily used for blocking the acid secretion in your stomach, which is a histamine 2 site. So you can actually take Pepcid, 20 milligrams, or Tagamet, 100 to 200 milligrams, as a histamine 2 blocker. Zantac is currently off the market. There were some carcinogenic concerns. I think that was within the last 2 years. So even though that's a first generation histamine blocker, you cannot find that. What do I suggest for taking for the histamine 1 and histamine 2 blockers? I actually dose myself if I get facial stings with not only the Benadryl along with a Claritin, or you can substitute Zyrtec. I take Benadryl, Claritin, and I take a Pepsid. It blocks the histamine release, not only from that venom, but also from the inflammation response for when that stinger is in you. This is very similar for what I do in the operating room prior to I need to expose somebody to something they're allergic to. This would be an IVP dye study, for instance. I pre-dose people to prevent that allergic response, that histamine response with similar products, and I use about 3 of them. Again, I caution you, if you decide to take this route with the dosing, make sure you've checked off all the boxes and read the precautions on these medicines, and hopefully never use it before you ever need to take it to cut down on your response to a sting. Now let's kind of move from normal treatment of a localized reaction to a sting to more serious reactions to stings. And these are reactions to the whole order of insects that honeybees are a part of, which also includes ants and wasps. About 3 to 5% of adults and about 1% of children have severe allergic reactions to this group of insects. This is the part, I don't really know what that percentage is for beekeepers because I couldn't find anything that broke down adults, non-beekeepers with beekeepers. I'm assuming, again, assuming, it's a bad word, that beekeepers, because of what we do, we probably have a slightly higher incident to severe allergic reactions, and that's just because we work with bees. When you're talking about an allergic reaction, you're actually talking about an IEG-mediated allergic reaction, and that's where that venom is considered an allergen. It requires a prior exposure, but the next time you're exposed, it causes a severe reaction in your body with a tremendous release of histamine. And remember, histamine's in the venom, but now your body is also releasing histamine because you're allergic to that type of bee, that type of wasp, that type of ant. And it can cause some potential fatalities. This is the definition of anaphylaxis. Please note this form of allergic reaction does require an exposure prior to that particular item that acts as an antigen that your body releases the histamine to. And it may be a food, it may be a drug, it may be venom. It releases those IgE antibodies and sensitizes the host. That second exposure releases crazy amounts of histamine with life-changing consequences. It's potentially life-threatening. It is usually rapid onset. You've all heard of the people with peanut allergies or shellfish allergies, and other particular antigens may include drugs or X-ray dye, which is when I pre-treat in the operating room because you need that contrast for the study or the operation. Also, latex sensitivity, even though it's less prone presently to be latex because we've gotten rid of latex gloves for multiple years, but also insect stings. And there's probably about 40 to 50 deaths attributed in the US to insect stings. Remember, this particular 40 to 50 deaths does not include numbers of individuals that have a severe anaphylactic reaction, is just who died.